Good afternoon, all. This is Dr. Vignesh Kumar. After a long time, I'm going to do a video presentation. Actually, I was thinking of regularly we used to go to the wards for the post-operative wards, surgical intensive care units, post-surgical units, seeing lot of patients on modified radical mastectomy, breast cancer patients. So the global burden is day by day, which is getting increased. I just consulted with many surgical oncologists. They told me it is about 2.1 million cases which was diagnosed worldwide, and 6 lakhs to 120 cases is almost getting death every year. So 2050 will be a global burden of this breast cancer. So this awareness must be created in the health to whole public, whole world. According to the World Health Organization, among the team of the doctors, physiotherapy plays the vital role. I just wanted to go through a research wise, a systematic review is a topmost research. So I've gone through one of the paper of single case study on 2021 done, the impact of physical therapy, the patient who is undergoing after the post surgery modified radical mastectomy. So Deshpande, Shivani and et al, the group has done this research, a wonderful research. They have conducted it. So usually what happens, yeah, among this research, a patient who is basically the majority of the patients was diagnosed as a breast cancer. This modified radical mastectomy has been chosen. So this is actually the operation that extracts the whole breast and the axillary area, or especially extract the lymph nodes, or lumpectomy can be done over that particular area. The procedure, which has been called as different types of words and names, among them the modified radical mastectomy, which is very common, done after the surgery, axillary lymph node discectomy, ALND, which is very commonly they have been done. After that, they will keep a drain through this axillary area. So for 2-3 days, they will keep with the incisions and drain to get the blood accumulation to drain out. So the third day, mostly they used to call physiotherapist for physiotherapy. So I noticed this single case study, a 60 years woman, a right-handed dominant, having a right breast, a lump called infiltrate ductal carcinoma was diagnosed by the sonologist in ultrasonography, as well as through FNAC, fine needle aspiration cytology. So that pathological examination has been done, confirmed it is an infiltrative ductal carcinoma, some sort of metastatic carcinoma. To save the life of the women, immediately they plan for modified radical mastectomy. So the patient admitted in the hospital. So why this is happening? Because of the unhygienic habits, pre-age menarche, all those things are the vital causes, or hormonal changes, even thyroid changes, all this which happens to produces a lump on the breast, which causes these type of a carcinoma in particular age. So they decided to extract that complete breast to save the life of the women. So they took over the surgery. Third day or fourth day, they called the physiotherapist, because commonly we can see a complications of shoulder range of motion restriction and lymphedema, axillary contracture, fatigue, some sort of breathing difficulty, anxiety, loss of hope, stress, emotional disturbances, all those things will be there. So the patient needs surgical dressing, nursing care, medications, along with very important thing, they have to return back to normal physiotherapy on day 3 or 4. Here in this research study, I have noticed 1 to 2 weeks, gradually they started the exercises with gradual slow deep breathing exercises for upper, middle, lower chest, and gradually started finger movements, elbow movements and shoulder movements. again 2 to 4 weeks, little bit improving the exercises. So pre-test and post after the physiotherapy, they have noticed the range of motion restrictions is 30 degree, 20 degree, flexion, abduction, internal rotation 10 degrees, and pain scale they noticed about 10, 3 or 4 out of 10 in the visual analog scale. And they have noticed the dash disability for hand hand scales. So these disability shoulder hand scale is a 31 item score. So self-reporting score they have noticed a moderate to severe difficulty. Post therapy they have noticed a mild difficulty, and range of motion restriction which is improved a lot to flexion is 150, abduction to 140, and rotation to 30 to 40 degrees. Muscle power strength, previously it was 3, and after that 4 plus to 5 it is increased. So resistance exercises plays the major role here. So this will improve the muscle strength. Not only it reduces the lymphedema also. There are a lot of research is going on. So ball squeezing exercises, mild weight exercises, and range of motion with some sort of assistance exercises, breathing exercises to remove the fatigue, cachexia, because post this surgical mastectomy, the patient has to go for chemotherapy cycles, 4 to 6 cycles. So automatically they will get cachexia, some sort of extreme fatigue. So we need to give a reassurance, anxiety to be reduced, and their hope to be increased, so functional scales to be improved. So they will keep the things in the high cupboard, they will wear their dress don and doffing, they improve the range of motion, muscle strength, everything will be improved. So the among these study for about 8 weeks, so 8 weeks, almost 2 months of therapy for the single case study, the outcome measure is significantly improved the range of motion, pain scale is reduced, muscle strength is improved, and functionally the patient becomes normal. So lymphedema, swelling is also reduced. So swelling can be tested pre-therapy, circumference of the arm, circumference of the forearm, and after the therapy you can check the circumference, it will be reduced. So all these things can be analyzed through the DASH scores, functional measurement scores, psychological scores, muscle power strength, pain scale, and range of motion. So physiotherapy plays a significant role. Among the systematic reviews also it has been proved that correlate with this single case study. Here I wanted to suggest proudly that daily we are seeing 2 to 5 cases minimum, maximum to 10 cases in surgical wards. I hope so in every medical colleges they are seeing this modified radical mastectomy. Definitely they are doing it. So we need to incorporate this research also, indulge to do the practice in the daily routine of post-operative wards. Thank you, and it has to be reached to all the physiotherapists in this auspicious day. Thank you.